Namaste everyone, Dr. Amit here. Hope you all are doing well. Welcome back to my YouTube channel at the rate Dr. Amit Official. It's a place for easy and effective medical learning. So if you haven't subscribed it, make sure to hit that subscribe button and stay tuned for more valuable content. So in our last video from microbiology series, we discussed about Clostridium species. In today's session, we move ahead to an important clinical gram-positive bacteria, that is Corynebacterium diphtheriae. And it is a very important gram-positive bacteria for asking questions in NMCL exam, USMLE Step 1, PG entrance exam and MBBS exam. So I'll explain this gram-positive bacteria in a simple and clear and exam-focused way. So let's dive in and get started with our today topic, Corynebacterium diphtheriae. So let's start our topic, Corynebacterium diphtheriae. Okay, so let's first talk about its lab feature. Okay, so we all know that Corynebacterium diphtheriae is a gram-positive bacteria, and it's a non-spore forming. Okay, a spore is not formed by this bacteria, and it's a club-shaped bacillus. That's a rod shaped. Okay, remember this club shaped. Okay, sometime in MCQ they give this club shaped. Okay, now it's a this bacteria has a special arrangement. Okay, so this is also an important line for MCQs. Okay, arrangement, just Chinese letter pattern. Okay, they often give the line Chinese letter pattern bacteria or angular arrangement. Okay, now what's the virulence factor due to which this bacteria is highly infectious? So diphtheria toxin. Okay, the toxin produced by this Corynebacterium diphtheriae is diphtheria toxin. It's an exotoxin. Okay, now how this toxin actually work? Okay, what's the mechanism of action? So this toxin actually inhibits protein synthesis. Okay, so how it, now we'll see how it inhibits the protein synthesis. Okay, so there is a protein called elongation factor 2. Okay, it helps in translation, that is protein synthesis. But to this protein, ADP ribosylation occur. It means ADP ribose is added to this elongation factor 2. So after adding ADP ribose to elongation factor 2, it become ineffective. Okay, so when it become ineffective, then there will be no protein synthesis. Okay, so this is how this bacteria inhibit protein synthesis, and that result in stop protein synthesis and cell death. Okay, now while talking about the pathogenesis, okay, how actually it causes disease in human body. Suppose you got infection in the throat. Okay, now toxin will produce there, this diphtheria toxin, and this diphtheria toxin will cause tissue necrosis and inflammation over there. Like suppose if in pharynx, then in pharynx, in cardiac or in CNS tissue. Okay, now we'll talk about some important sign and symptoms of Corynebacterium diphtheriae. Okay, so this is very important. Pseudomembranous pharyngitis. Okay, it's a gray-white membrane that bleeds on removal. Okay, remember this line. They often put this word in MCQ. Pseudomembranous pharyngitis, or they can say bleeds on removal. That white membrane, if we scratch that white membrane, that it bleeds on removal. Okay, then lymphadenopathy, that is bull neck appearance. Remember this line. Then sore throat to the patient, fever and dysphagia. Okay, problem while swallowing. Now this is what are systemic complications. Okay, so after having infection from this bacteria, Corynebacterium diphtheriae, what are the systemic complications will arise? Okay, so the systemic complications will be myocarditis. Most often they ask this in USMLE Step 1 and INACT exams, that what's the main complications? Myocarditis. Okay, in the heart, arrhythmia also. Okay, and neuropathies like cranial nerve palsies. Okay, now suppose after getting infections from Corynebacterium diphtheriae, how will diagnose this case? So in lab diagnosis, we all know that's a gram positive rod. Okay, with metachromatic granules. Okay, remember this term. Okay, metachromatic granules. Okay, now we can do for toxin detection, this toxin, diphtheria toxin. To detect this, we have a special test known as ELEK test, ELEK. Okay, ELEK test. Okay, now we can culture this bacteria in Loeffler media. That's a club shaped. Okay, I've told in the starting that it's a club shaped bacillus. Okay, so which media is used over here? Loeffler media, club shaped. Okay, now how to treat this. Suppose if anyone got infection from Corynebacterium diphtheria, then how to treat? Okay, so one is to neutralize this toxin. We can give diphtheria antitoxin. Okay, and with this we can give erythromycin or penicillin. Okay, now if anyone has got or is suspicious, then how can you prevent this infection? Okay, so to prevent this, we can give a vaccine known as diphtheria toxoid vaccine. We often give this vaccine with DPT vaccine part. Okay, so diphtheria toxoid vaccine. Okay, so this is all about Corynebacterium diphtheria. It is one of the most most of the questions asked in the entrance exam from this topic. Okay, Corynebacterium diphtheria, and even in clinical practice also Corynebacterium diphtheria is very important. So this is all important points about Corynebacterium diphtheria. Now I think you can solve all the important MCQs for NMCLE or USMLE or any PG entrance exam or MBBS. Okay, after having this much of informations. So thank you for listening, and if you like this video, please share with your fellow medicals, and we'll meet again in the next video with one of the most important topic of MBBS subjects. Till then, work hard, keep studying. Thank you.